Hello. Hello, how are you? My name is Zakir. I'm going to be your provider today. Can you tell me your name and date of birth?
Obeyed 01/11/2011.
Okay. Can you give me a consent to do the assessment on you and post on the video?
Yes.
Okay. I'm his dad. I'm going to give a consent too. Okay. Why you coming to the clinic today?
For a chest checkup.
Okay. Thank you.
Checkup.
Okay. So I'm gonna do assessment on you. I'm gonna touch you. I'm gonna listen by stethoscope, and I'm gonna see everything. Okay?
Okay.
Do you have any cough, any fever, anything?
No.
Okay. Thank you so much. So what I'm gonna do first, and I'm gonna see just an inspection about the patient chest. When I see the chest is symmetrical, there is no deformity, there is no burial chest, no scars, and the breathing is like easy breezy, and there is no like any shortness of breath, and I can see there is no intercostal and the subcostal or diaphragmatic breathing, and when I see the patient lips, his lips is not cyanotic. There is no flaring of the nose. And can I see your finger? Okay. There is no clubbing of the nails, and there is no sign of respiratory distress. And the second thing is what I'm gonna do is I'm gonna touch you, okay? So I'm gonna do palpation, and the palpation is I'm gonna do his chest if there is no air trapping, and costochondral pain around this. If there is any pain by 3 fingers, there is no. Do you have any pain?
No.
Okay, I cannot see any feeling. And what I'm gonna do is I will do the tactile fremitus, and I will do the anterior and the posterior differently. I will do the anterior first, and I will do the posterior first. I'll do the posterior second. So would you say tactile fremitus? Would you say 99?
99. 99. 99. 99. 99. 99. 99.
Okay. There is so there is all everything is looks vibration. If there is, if there is a female patient all the time, we have to tell the patient to raise their bust. We have to tell to the patient to raise their bust, and that's that way we can do on that. So I will do respiratory excursion or diaphragmatic excursion on the back. Of course, I was supposed to do on the anterior and the posterior, but the anterior is I will show that diaphragmatic excursion on the back. So the second thing what I'm gonna do is I will do the percussion. Okay, would you lay down? Okay, yes. Thank you so much. So when I do percussion, and I have to use the middle finger and the middle finger, the top of the middle finger, I have to hit like this. What I'm gonna do, symmetrical pose. So I can do diaphragmatic excursion if I want it over here, and I can tell the patient breathe, but the easy way is I'll show to the back of the posterior of the patient. So when I do the percussion, is all areas are resonant, and would you sit down, please? Thank you so much. So last thing what I have to do is I will do the auscultation. Yeah, take a deep breath. we have to do the ladder shape to come down. As I mentioned, if it is ladies, and we have to tell the patient to raise the breast area by himself or by herself. That way it's gonna be makes easy. Okay. All the breathing, all the auscultation, the lung areas are clear. There is no sign of pneumonia or any breathing problem. There is no wheezing. There is no any respiratory problem. So what I'm gonna do, would you turn around to the back? I will do everything that what I did, the same thing that what I did on the front. Right now, the posterior side. I'm gonna start from inspection. Also, the inspection. There is no. Is the skin color is normal skin color. There is no sign of intercostal or subcostal diaphragmatic retraction. It's not cyanotic, and the breathing looks even, and there is no any deformities in the back too. This is an inspection. The other thing is I will do palpation, the same thing. There is no air trap over here. There is no. Okay. And I will do the diaphragmatic excursion over here. What I'm gonna do, I'm gonna tell to the patient, and well, would you say 99? Wait.
99, 99, 99, 99, 99, 99, 99, 99,
We'll do over here too.
99, 99.
Good job. So we have to. There is all the lung areas are vibration except those areas, and I'll do the diaphragmatic excursion over here. I'm gonna tell to the patient, and would you take a deep inhale and hold it? Okay. Would you take inhale, breathe in and hold it? Okay.
Okay.
Do it. Say. Swallow, like hold it, the breathing. Okay, good job. Okay, I'm gonna percuss. Just no, hold it, Baba. No, hold it. Just breathe in and hold it. Okay, good job. I'm gonna percuss it, and I will mark it the place where I got the down. So I'm gonna make a mark over here, and right now exhale. Okay, breathe out and hold it. Okay, Baba, obey. Yes, hold it there. Okay, I'm gonna do the same thing that what I did. So I'll mark pause, and if I measure this one, both of them like around 3, that means the difference between the diaphragmatic movement between inhaling and exhale, or like around 3 centimeters, which is a normal measurement. So this is all about. So what I'm gonna do right now, I will do. I'm gonna do the percussion. The same thing that what I did. When I have to do percussion all the time, I have to do between intercostal space. If I put it all over the bony, it's gonna be dull. So the last thing what I have to do is I have to do the auscultation. Take a deep breath. This is a ladder to come over here. Okay. The last thing what you have to do is I'm gonna check the special test. The special test is like in order to find out if the patient has a lobar pneumonia or any thing in his lung base, and we have to check from 3 of them. We have to at least one. I'm gonna do the egophony. Okay, so the egophony is mostly like I'm gonna tell to the patient to say A, and when the patient say A, if I hear A, that's abnormal sound, and rather than I have to hear the same sound. And you're gonna say E, okay? E, okay?
Okay.
Say
E. 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 E.
okay. So there is no abnormal sound. Everything looks perfect, and that's all about our my physical assessment. And if there is something, do you have any question?
No.
Okay, thank you so much for allowing me to do the assessment on you. Okay.
Okay.
All right, thank you so much. Okay.